Welcome back to Health Awareness. Today, we're diving into a crucial topic, the ongoing fight against HIV-1 and the role of toll-like receptors, TLR, in this battle. HIV-1 is classified as a viral species within the family Retroviridinae, subfamily Orthoretrovirinae, and genus Lentivirus. This category also includes HIV-2 and the simian immunodeficiency virus, SIV, which infects non-human primates and serves as an essential experimental model for HIV immunology research in vivo. According to the Joint United Nations Program on HIV/AIDS, UNAIDS, data for 2021, there were 37.7 million, 43.1 million, 45.1 million, 45.1 million people living with HIV/AIDS at the end of 2020. The majority of these individuals live in Eastern and Southern Africa, with an estimated 20.6 million, ranging from 16.8 to 24.4 million. Despite a significant reduction in the number of new HIV-1 infections over the last decade, 1.5 million, 1.0 million, 2.0 million, 2.0 million new infections occurred during 2020, including 150,000 infections in children under 15 years of age. Despite effective antiretroviral therapies, infection with this virus led to an estimated 680,000, 480,000, 1.0 million deaths in 2020, emphasizing the need for continuous efforts to develop feasible strategies to treat these infections and to create an effective vaccine. Although 40 years have passed since the isolation of HIV-1 by 𝗗𝗶𝘀𝗰𝗹 et al. In 1983, and despite significant achievements in basic and clinical science, innate and specific immunity to HIV-1 remains an exceptionally important area of research. Currently, HIV treatment is based on a combination of antiretroviral drugs from several classes designed to target various stages of the virus replication cycle. These include reverse transcriptase inhibitors, protease inhibitors, integrase strand transfer inhibitors, capsid inhibitors, entry inhibitors such as the fusion inhibitor enfuvirtide and CCR5 inhibitor 𝗗𝗶𝘀𝗃𝗃, attachment inhibitors, and a CD4 directed post-attachment inhibitor monoclonal antibody. Antiretroviral therapy, ART, is exceptionally successful in reducing the intensity of viral replication, but fails to eradicate the virus and is unable to cure infected individuals. To date, only some individuals have been cured of HIV-1 infection using stem cell transplantation from CCR5 delta 32 homozygotic donors. Even in successfully treated patients, HIV establishes latent reservoirs, most frequently in memory CD4 plus T cells, where it remains in a dormant state, invisible to the immune system. The presence of a latent viral reservoir is the key obstacle to curing HIV. Several therapeutic strategies, including the shock and kill approach, aim to activate HIV-1 replication in latently infected cells, allowing their recognition and elimination by the immune system. These strategies involve latency, reversing agents, LARAs, such as protein kinase C, histone DST, histone deacetylase inhibitors, and toll-like receptor, TLR agonists. Toll-like receptors, TLR, a family of pattern recognition receptors, play a critical role in recognizing HIV-1 molecular structures by various cells of the innate immune system. They also provide a functional association with subsequent adaptive immune mechanisms. TLR7 and TLR8 are particularly important in the innate immune response to RNA viruses, as they can recognize GU-rich single-stranded RNA molecules and subsequently activate intracellular signaling pathways, resulting in the expression of genes coding for various biological response. Modifiers such as interferons, pro-inflammatory cytokines, and chemokines. Sengupta recently reported results from a randomized, double-blind, placebo-controlled phase I clinical trial on an TLR7 agonist, 𝗗𝗀𝗀𝗃𝗀𝗃, in successfully treated HIV-infected persons. An oral TLR7 agonist induced immune activation of DCs and NK cells, leading to a decreased quantity of intact proviral DNA in the patients. Lower quantities of intact proviral DNA 13 days after the final dose of the TLR7 agonist also predicted a delayed viral rebound in the patients. These results showed that TLR7 agonists might represent an option in treatment regimens aimed at long-term control of HIV-1. The most recent study by Ridler et al. 2022 reported results on the use of a TLR7 agonist in a double-blind, multicenter, placebo-controlled clinical trial that included 36 successfully treated patients with undetectable 𝗗𝗶𝘀𝗰𝗹𝗶𝗺𝗃. These results showed that TLR7 agonists represent a promising candidate drug aimed at achieving immune stimulation in future clinical trials assessing the efficacy of HIV candidate vaccines. The future of TLR agonists in clinical trials involving therapeutic vaccination and in research into the development of a functional cure for HIV-1 infection looks promising, with several studies that are currently recruiting patients or have been announced. Currently, there are 2 clinical trials that will evaluate the role of TLR7 and TLR9 agonists combined with 𝗗𝗶𝘀𝗃𝗃 agonists combined with 𝗗𝗶𝘀𝗃𝗃 potential tools to achieve long-term virological control in HIV-infected patients. An interventional Gilead Phase 2 clinical trial, NCT 5,281,510, will evaluate a sequential regimen of HIV and V-specific monoclonal antibodies VRCS7, 523LS, and CAP 256 V256 V2LR7 agonist 𝗗𝗂𝗃𝗃𝗃. The trial will include 25 women infected with HIV subtype C that started antiretroviral therapy at the acute stage of infection. The trial will monitor time to virological rebound, viremia at the end of analytical treatment interruption, ATI, as well as the time to antiretroviral resumption. This trial is specifically designed to address the issue of HIV-1 subtype C infection in women. The focus on women is particularly important due to a well-established fact that gender inequality and harmful gender norms restrict women's access to healthcare services, related and non-related to HIV, and results in a disproportional risk for acquiring HIV infection. According to the UNAIDS epidemiological estimates, there were 260,000, 150,000, 390,000 new HIV infections globally among adolescent girls and young women, with 83 of these infections occurring in sub-Saharan Africa, where adolescent girls and young women, aged 24 years, account for 25 of NIC infections, despite representing only 10 of the population. Therefore, clinical trials addressing specific vulnerable groups such as women infected with subtype C are of utmost importance in HIV medicine. Also, the University of Aarhus has announced a Phase 2 investigator-initiated randomized placebo-controlled clinical trial evaluating the effect of the TLR9 agonist 𝗗𝗶𝘀𝗃𝗃𝗃 in combination with broadly neutralizing NV-specific anti-HIV, NV-specific anti-HIV antibodies 3BNC117, 1074 in individuals on ART and during ATI as an intervention to reduce the HIV-1 reservoir. The study is designed to enroll 47 HIV-infected adults aged 18-65 years that have been treated with antiretroviral drugs for a minimum of 18 months and had undetectable viremia, as well as 400 CD4 T cells at enrollment. The study will evaluate the sensitivity of the viral reservoir to neutralization using a standardized Phenesense HIV mAb assay, or HIV-1 DNA envelope sequencing, in combination with an appropriate bioinformatic algorithm. The aim of this video is to summarize the current knowledge on the role of TLR in recognizing HIV-1 molecular patterns and activating innate immune responses to the virus. In our subsequent videos, we'll explore the role of TLR agonists in current and future clinical trials aimed at developing HIV-1 vaccines and novel therapeutic strategies for a potential cure. And that is it in today's video. Thank you for joining us on this informative journey. Don't forget to like, share, and subscribe for more updates on health awareness. Congratulations if you're already subscribed. You're among the 1.5 who take their health seriously. If not, hit that subscribe button now so you won't miss our next video.